Hello, everybody. My name is David Bouch. I currently serve as Chief of Service Excellence at the corporate level at Astra DM Healthcare, physically, geographically located here in Dubai, the United Arab Emirates. Today, we're going to talk a little bit about the importance of digitization and service excellence for medical value travel consumers, or medical tourists, basically. I want to start off by sharing with you that I'm going to share a number of initiatives that we have going on at Astra DM Healthcare. Some are in an iterative fashion. So we are, again, a body in motion, and we are not where we aspire to be exactly, but we're working hard to get there. I'm going to first share with you a few things about Astra DM Healthcare. So first, from the service excellence perspective, for this whole pillar within our organization, we actually have a mission statement, and that is to establish Astra as one of the most sought-after healthcare providers globally by creating a seamless, unforgettable experience for our patients, visitors, and family members. So pretty ambitious goal, if you will. A couple of slides about Astra DM Healthcare from a high level. So today, we currently have half of our hospitals and half of our facilities are in GCC in the Gulf region, and the other half are located in India. And as you can tell from this screen, we have 26 hospitals total. 13 are in the Gulf region, and the other 13, again, are in India. 115 clinics, 225 pharmacies, a total of 365 facilities, but of course that number is increasing as well. A couple of important things on this slide. In the current year, we'll actually treat over 20 million total patients, and we have close to 19,000 Asterians working across all of our organizations. Next, I want to share with you a little bit about the whole patient experience and the role that we think that technology is playing today and will play in the future. So some of the goals specifically that technology can assist and can enable to help us improve the patient experience are specifically improving the measurement, right? So we want to measure as much as we can, as quickly as we can. We think it will help us improve our patient experience and the whole consumer engagement, if you will. We believe that increased the patient experience will actually improve our healthcare outcomes and our patient care. And again, on this whole journey, we are very much a work in progress. We are really in some of the first steps of this journey. But I will tell you that on the measurement side, that we understand, we believe that what we measure, what's measured can be improved, and of course, what's rewarded can be repeated. So there's a number of elements that we've developed and are in the process of developing in-house to develop and improve our whole voice of customer platform. We're focusing, and we're currently at 100% digitization. We actually seek data and get data, patient feedback, consumer feedback from 11 different channels. So things like mobile tablets at the bedside. We have QR codes throughout the facilities, both our outpatient clinics and our hospitals. We have a number of kiosks throughout our facilities as well. And unlike some hospitals, we actually require people to use them to actually give us their mobile telephone number. So we just don't want a little child there sitting and pushing a smiley face for 100 times. So we require that. And of course, we utilize that information to improve the patient journey. So in addition to the kiosks, we also, of course, use Google ratings and things of that nature. We have 45 different cuts of the data that are available. We also send out SMSs. And as you can see, we get about 3% collection feedback specifically from messages, from SMS. From inpatient, we entrap information and feedback from about 55% of our inpatients across the organization, and about 11% on outpatient. Now, we think 11% on one hand is higher than average, but we really would like to see it get up closer to 20%. And we have found that the number one way to improve our collection rates is to ensure that our consumers know that we're listening to what they're telling us and we're making changes along the way. And then we centralize a lot of this information in a dashboard based on your different levels in the organization. So we actually have real-time dashboards that as surveys are coming in, those are updating. So specifically in measuring the voice of our customer, some of these statistics come from our Medcare division here in Dubai. So this is about 24,000 total inpatients a year, greater than 1 million outpatients. As you can see here, over 250,000 meals served. And again, we're trying to capture up to 80% of our inpatient, and again, 5-10+% of our outpatients. Now, over time, we've been challenged, as you see in the far right. We had a manual process with relatively low capture rates. We had no complaint management system, no data, no query management system. We had very poor accountability. And so because we had really a poor measurement, we did not have a lot of patient engagement and stuff. But all of that is changing, as you'll see. So right now, our focus is to really develop a multi-channel digital patient experience with live dashboards, as I mentioned prior, increased accountability, of course, throughout the organization. If we get a signal from a patient about something that needs to be fixed, if it goes, depending on what exactly it is, if it's more than 30 minutes, it goes up directly to the hospital COO or CEO to address. And then finally, in the bucket, it's about rewarding and recognition. So we know, again, as I mentioned previously, that we know that what's rewarded is repeated. And so one of the things that we're doing is we're getting creative about our recognition program. So moving on, I wanted just to share with you, illustrate some of the dashboards that we're using as we measure this voice of consumer. So we actually have a total of more than 50 dashboards that are available on the application that we're using with a number of different multiple data cuts. So basically, this is Moneyball 101. You can really slice and dice and look at the data about any way you want. Specifically here on the screen, what I'm sharing with you is Net Promoter Score. So as the Net Promoter Score is changing throughout a day, throughout a week, throughout a month, throughout a quarter, the end user can see that. Our overall patient satisfaction, our expectation management, again, is important. Again, our Net Promoter Score. Would you be willing to refer our facility or our outpatient services to family and friends? Again, we have digitized our complaints, suggestion, and compliments, and with a much greater emphasis on compliments, as you might imagine. And again, we're looking at this data through a number of different channels. But we also look very specifically at the number of irritants. One of the things that we've learned specifically from the Ritz-Carlton organization, the Ritz generally only looks at 20 and measures and really looks at only 20 main elements because they know that if they focus on and improve those and keep those 20 at a very high level, that they basically have increased occupancy in their hotels, and they can actually charge a little bit more as well. So we're not quite at 20. We have a few more indicators and bogeys that we're looking at, but that's, again, where we aspire to be. On this slide, what this slide shares with you, again, is some of the specific dashboards that, again, the department managers, the service excellence staff, the chief operating, the chief nursing officer in our facilities have as well. And as I mentioned a couple times already, again, these numbers are not what we aspire to be. We're a work in progress. We've had this system running for under a year now, but so far we're pleased with the progress. And one of the things that I try to impart to my staff and to our teams here is that we are focusing on progress, not perfection. We can make a little bit of improvement every single day, every single week, every single month, every single quarter. We're continually going in the right direction. So specifically, on patient satisfaction, again, taking into account, we basically ask the question, as you can see here, taking into account your overall healthcare experience, are you satisfied with your experience? Next, from a Net Promoter Score, how likely are you to recommend us to friends and family? On the loyalty meter, how likely are you to continue to choose our Medcare hospital or clinic the next time you need medical care? And then finally, from an expectation management, were our staff, the ability of our caregivers, were we able to meet or exceed your expectations? So those are the four main areas that we're focusing on. One of the initiatives that I wanted to share with you today is something that we're about halfway implemented throughout our Medcare division. And that's a service, a product we call One Touch. And these are basically bedside tablets that we have throughout the hospital. And one of the things we realized is when we went through and enumerated and really analyzed the data, we found that about 35% of the inquiries that our patients were hitting the nurse call bell, about 35% of those had nothing to do with nursing. So we developed using an app, a bedside app called One Touch, and really allows the patient to have much greater control over their room temperature, their need for water, if they need housekeeping, If they have a problem with the television set, we have smart TVs in our hospitals, or do they have a problem with Wi-Fi, right? Those inquiries go directly to the people who can help them. And one of the things that we found out is that this tool can help us save upwards of 35% of nursing time. Increasingly, our hospitals are working in a DRG environment. And one of the things that we know, about 10 or 15 years ago, an article was published in the New England Journal of Medicine, which statistically indicated and illustrated that an increased amount of nurse face time that patients have with nurses, actually they heal more quickly and they're discharged from the hospital sooner. So what we're trying to do is free up as much as our nurses of their time with administrative tasks so that they can focus more on what they really were trained to do, and that's taking care of our patients and our consumers. So again, if we can implement this throughout and improve our nurse productivity by 35%, we want to try to do that. So the next slide here basically shows you, it's a screenshot of what this looks like. So as you can see, the patient can push on if they need something with food or linen or the room temperature, television, or whatever. They can basically do that. Again, it goes right to the department, right to the person who's on call, who can help the patient with that. And if it's not tended to within 15 or 20 minutes, again, their supervisor or manager gets a signal on their phone, and eventually we have thresholds set up. They go directly to the COO or CEO of the hospital. So this really allows us the need for the patient to touch one time, and it prioritizes exactly what matters. So I want to make the jump from what we're doing with One Touch into the whole area of medical value travel. Some of the things that a lot of folks may not know, obviously in the COVID world, we're not actually in the post-COVID world yet worldwide. But one of the areas that we know is that Dubai is a really, really interesting place with a number of different nationalities living here and traveling here. But one of the things I want you to know is that Dubai is absolutely open for business, right? So this is a brand new website that we've recently launched, astromedicaltravel.ae. It's intended to be a one-stop shop for medical travelers, for employers, and for medical travel facilitators. And oftentimes our chairman likes to basically share the analogy that if you're looking for business class or first class, you may want to go with the Medcare brand. If you're looking for coach or premium economy, you may want to go to our Astra brand. So from both of our brands, you're able to go to the same site and you can pick based on price and other product differentiations. And it's pretty interesting. There's not a lot of other provider groups offer that. In fact, nobody that I'm aware of. So again, I want you to know Dubai is absolutely open for business for medical travelers. And I will share with you an interesting statistic. In the last 3 months alone, when many countries around the world have their borders closed, we have treated here in Dubai in our Astra and Medcare facilities patients from over 152 countries around the world. So a pretty significant number. We see that increasing as well. The next couple of slides simply are screenshots of this astromedicaltravel.ae website. Again, this one illustrates that, in fact, one of our core beliefs, we believe that doctors and, in fact, nurses are our life force. And we believe that in designing hospitals we do so to really maximize the whole healing process. So our VIP suites and royal suites and things of that nature, you'll see they're really very nice from a luxury perspective and stuff. So next, I want to share with you a little bit about what we're doing with technology also to improve the whole patient experience. And that is, we've recently launched our One Astra mobile app. So if a consumer today goes out here in Dubai, goes into the Apple store and basically looks to download an Astra app, you wouldn't really necessarily know exactly which one to download. There are a number out there. But in a relatively short period of time, within a month or two, that's going to change. And there'll be only a single One Astra mobile app. And right now, this allows us the ability, and again, this is all a work in progress as well, but patients from really anywhere in the world, they can basically go out. We're using this. The first launch is for telemedicine visits, telehealth visits with different specialists. I'll share a little bit about that on a subsequent slide. So patients then can go out, they can read the bio of the physicians, find out perhaps how many procedures that they've done. and they can actually go ahead and make an appointment booking right through the mobile app. And over the next several weeks and months ahead, we'll be having additional releases on this on One Astra mobile app on a pretty regular basis. So think in terms of your results reporting, where patients can go out and get lab results, radiology results, and other, cardiology, some of the other things as well. But then also e-prescribing as well. As I mentioned in one of the earlier slides, we have several hundred pharmacies throughout the GCC and increasingly in India as well. So patients will be able to utilize the e-prescription. So specifically, as I mentioned, the initial rollout, the main, in addition to appointments and appointment booking in One Astra, is Astra Telehealth. And so it's for so many ways, the pandemic going back to Q1, Q2 of 2020 really enabled Astra DM to delve into the whole telemedicine area, foray, if you will, in a very, very large way. So if you can see from this slide, so far to date, we've end-to-end, we've provided over 160,000 teleconsultations over the last 8 months. We have 53 specialists that are available 7 days a week that are available. We provided care in 5 countries, patients from where the majority, obviously, of our hospitals are. We have over 800 distinct physicians working amongst Astra that are regularly involved in the Astra telehealth. So the whole focus for us, of course, is that we have a total seamless integration with hospital care. So back to the whole medical tourism, medical value travel. So pre-service and post-service, patients, consumers, once they become patients, are able to connect with their physicians pre and post surgery in right through this app, and everything is all handled into a single EMR. So today, and one of the things that we think is that that right now, one of our Astra or Medcare physicians can really is the furthest away they are is 83 centimeters, and that's the length, the average length of a human arm. And so if you can push the button and you can have access to one of our physicians. And finally, one of the things I want to share with you specifically that ties all of this together is that Astra has embarked on a mission. Our brand is spreading into the Western Hemisphere. We are in the process of building Astra Cayman Med-City Hospital in the Cayman Islands, in the Caribbean, the Western Caribbean. We absolutely intend for this to be Western Caribbean's most technologically advanced hospital. We will have the only NICU, neonatal intensive care unit in the Caribbean. And this is going to be really in a several phase project, 3 main phases. So you see here an artist rendition of the hospital. We are breaking ground on this facility over the next 60 to 90 days, and it'll be finished either sometime at the end of 2022, early 23. But in addition to the hospital, again, multi-specialty, very high tech, the next phase of this project will be an assisted living program as well. And so you see here housings, and so it'll be on the assisted living facilities, and step down will be on the same campus as the hospital and our restaurants and everything else, along with retail. And then finally, in phase 3 of this whole project, we'll actually be building a medical school. As you see, it says Healthcare University, very similar to one that we've also started years ago in southern India, in Kerala. And so we're excited about this as well. We know that we need to increase the number of physicians worldwide, certainly in primary care, intensive care, intensivists, but specialties as well. So we're pretty excited about this, and we know that when we're done, when this hospital is opened at late 2022 in 2023, we know at that point that the sun won't set. The sun will never set on the Astra brand, and so we'll continue to expand that. The Cayman facility will almost significantly be medical travel, the facilitator, medical travel, patient-centric. So we're looking obviously for patients to be visiting us from North America as the cost of healthcare continues to climb in America, as the queues continue to climb, both in Canada and in Great Britain. We think this is going to be an interesting opportunity for us. In addition to, of course, Central America, patients coming from South America and the Caribbean as well. So with that, I thank you very much for your time and attention. I'm happy to answer any questions now, and we'll open that up. So thank you very much and have a great day.
And here is David now to answer your questions. Good to see you, David. How are you today?
I'm well, thanks, Dave. Hope you're doing well.
I am. I mean, we've all been focusing on our health. We've been forced to, haven't we, in the last 12 months? I don't think there's ever been such a focus. Some people are ignoring it. You know, when you look at some of the statistics that say you should look after yourself, you know, maybe lose a bit of weight, maybe have a better diet, do some exercise, things like that. Some people are ignoring it, but there is this massive focus, and you're absolutely right. You know, with the queues, people will have to look elsewhere. And you were very upbeat and optimistic about that.
I am, Dave. I think if you look at some of the interesting things that are going on right now, I mean, we know that, for instance, Dubai, there are 2/3 of the world's population is within an 8-hour flight of Dubai, right? Number one. Number two, another point I made during the presentation is so far, just in the last 3 months, we've treated patients from 153 countries around the world. So Dubai's open for business and things. I think that I think that increasingly, because there is pent-up demand in a number of countries for a number of reasons, but you bring up a really, really good point, Dave, and that is about wellness and take care of yourself. And I'm, you know, I'll admit in a public domain like this, I contracted COVID back in early March, and I had no idea that I had it. I'm a daily runner. I run 5K just about every day, and I went to get my pre-flight COVID test before coming from Florida, from South Florida to Dubai, and I actually tested positive, and I was amazed. I said, it can't be. I was totally asymptomatic. The reason I bring that up is not to be boastful, but it's just to share with you, to reinforce the point you just made, is that I think it is important for us to take care of ourselves, and we know that the greater we take care of ourselves, the less impact that diseases like this, viruses like COVID are going to have on our bodies. So, I think it's a testament to good living. And I think increasingly patients are going to access Astro DM and our different verticals for the different wellness services that we offer.
Yeah, wellness. I mean, and well-being, both physical, mental. It's an interesting topic, and it brings in a lot of other agencies and partners. Some smaller ones, some larger organisations. I too had COVID quite seriously back when it was first sort of breaking in the UK. And I, like you, think of myself as a fit guy, and I often look back and think, did I survive because of that investment in my health? You know, following a Mediterranean diet, doing some aerobic exercise. I guess I'll never know, but it certainly hasn't hindered me. I can't imagine, and I'm still in recovery now. Some questions from people who've been joining us, David. It says here,
sure.
With such a large app development, how long did it take to roll out, and what is the plan for future rollout?
Sure, great question, and happy to answer. We actually looked at 2 or 3 different platforms upon which we're using right now, and I'm happy to mention the vendor's name. I didn't in the presentation for obvious reasons, but the whole dashboard system that we use to collect all the 11 different channels of information on the whole patient journey is called DreamSol. It's based out of Mumbai, India, so you can research that. Happy to send information. The One Touch at the bedside, I talked a little bit about that. Where the patients basically can bypass the nursing for things like air temperature, or their Wi-Fi is broken, or they'd like something to eat. We use a company called TreatWell. They're also an Indian-based company, and again, happy to share the details for that. The actual mobile app, the One Astro, that we've actually developed that ourselves, that we're introducing. So I talked about telemedicine and the visits and some of the things that we're moving forward to with patients being able to access their test results and things of that nature and make payments and all that. That's something we've done internally. So 3 separate platforms that I discussed.
When we start to look at patients as customers, clients, people who we need to treat well, like you would as a hotel guest, as you mentioned, do you incentivize, or do you propose to incentivize staff to look after these people, or do they see that as part of their role?
They don't yet. So a couple of times during the presentation, Dave, I mentioned the phrase that we're focusing on progress, not perfection, right? We are not what we aspire to be. We're definitely a work in progress. But both of those, the things you just mentioned, is absolutely, we expect to get there. So two things. Number one, we know that what's rewarded is repeated. And we're actually in the process right now of developing some programs that we will reward staff if they are specifically called out by name in our patient satisfaction survey. That's really important, right? We want to focus on the positive. And especially, some of the caregiving links for sure. I mean, so many times our frontline nurses hear the negative and the lab techs and things about how they could have done better and should have done better and everything else. But we want to really, really enforce the positive. And then the second thing you mentioned was about, gosh, I forgot. About doing the same thing, about expecting and improving the whole patient journey from a hotel perspective. No secret, we are actively recruiting patients from some of the top hotel brands like the Taj Hotel, the Oberoi, the Ritz-Carlton, from some of the airlines, and the Emirates Air. We've recruited staff in the last 3 or 4 months, Qatar Airlines. And so we need to make that pivot. We can't obviously replace all of our caregivers from the hospitality side, but we're trying to vacancy by vacancy to see if we can add that complement for sure. It's a totally different way of thinking.
It is, and maybe that relates to this question. Do you think people's expectations have always been traditionally low of healthcare services, and that this is going to come as a bit of a surprise, that actually they might get a meet and greet package, they might be offered a coffee and somehow a choice from a menu, and all of these things that potentially could come in? This is going to come as a bit of a surprise because expectations are traditionally low, aren't they?
They absolutely are. And as you point out, most patients, if they're not going for wellness, for cosmetic surgery or something like that, don't really want to come to a hospital. You don't really want to be in a clinic, right, for a number of different reasons. And so that's exactly the case. So what we try to construct here and try to work with our staff is, meeting the customer's expectations is a pretty low bar, right? That's what you just mentioned, because the expectation level is not very high. So we have to meet their needs and exceed their expectations. That's the goal. We're crystal clear on that. And so not to be confused with Crystal Palace, but crystal clear on that we need to exceed our customers' expectations. So.
And of course, I mean, it sounds like you're making great progress, and we'll talk about the future in a minute, but of course you're still playing catch up because other industries have been doing this for years, haven't they? Online reviews, forums, communities where you can share your opinions, that sort of thing. Bit of late to the table, but better late than never.
No, you're absolutely right. So we look at our Google ratings in real time. Our real-time dashboards, we're monitoring those. Again, we're maybe 4.1, 4.15, 4.2. We think we can do better. We're going to certainly strive to do better. But as you know, Dave, once you get to about 4.5, 4.6, it's really, really difficult to move the needle that last measure. But we're going to try for sure. So we're doing a number of things that I've talked about today.
Sure, and I guess that it could be frustrating, so that it depends where you're located in the world, in a particular region, in the country that you're in, that you might see that one service provider is providing brilliant care, your provider is pretty poor, but you don't get a choice because you have to go to the local provider, and they're dragging their feet. That's a challenge.
Yeah, it is a challenge, and I think. But I believe that consumerism is king, right? I believe that the educated consumer will be Astor's best customer, right? And I think so. We're absolutely a work in progress, and we know we can create stickiness really by exceeding the customer's expectations. They'll want to come back, and that's the case. I mean, we have certainly a high percentage of loyal customers and loyal patients. But one of the things that I try to drive home on a pretty regular basis is that we have competition. Right, Dubai is a very, very competitive market internationally and on here just internally in the UAE, and so we have to remember that, and we have to honor our customers by trying to every single day get a little bit faster, get a little bit better at what we do. I'm convinced that over time, that I refer to this as the 3 S's, Dave, that first and foremost, patients will go to where the safest care is, second, where they get the best service, and the third will be savings from a cost perspective as well. But Some people obviously travel for savings for price first, but I think increasingly through the transparency of data, I think safety is going to be number one.
Yeah, I think that's a brilliant way to summarize that. I mean, in terms of you mentioned not perfection but progress over the next few years. Things have moved rapidly in the last 18 months, 2 years. What do you see happening over the next 5 to 10 years in the field of health tech?
Gosh, it's wide open. I think one of the things that that the pandemic has taught us is that a lot of employees who we used to thought had to work at the hospital now we know can work at home. So that offers up a ton of opportunities for outsourcers and in-services and insourcers. And I think telemedicine and at-home monitoring and everything else has taken off. And I've been a fan of telemedicine since the late 90s. So it's really, really nice to see where this has grown. You know, we may not go back to the level we were at the height of the pandemic, but a lot of people who have experienced telemedicine visits around the world are very, very satisfied with that. And it's been a huge boost. So I think it's a positive thing.
Brilliant. Well, it's been an absolute pleasure to chat with you and hear what you've got to say. Like all of our presenters today, it feels like you're positive, you're upbeat, and considering the last 12 months, that's an absolute delight to hear.
You bet. Well, thank you for the opportunity. I can tell you at AstraDM Healthcare, we have used the last year plus, and we have worked really, really hard. You know, we've taken care of our employees the best that we possibly could and our patients and everything else. But we've used the time and we've used virtual platforms, but we've had a lot of initiatives in place. So it's quite frankly, it's a very, very exciting time to be here.
Brilliant. Well, it's certainly focused minds and hearts as well. David, thank you again for joining us. Enjoy the rest of your day, and maybe we'll get the chance to chat again soon.